Great. Good morning, Wakefield, and thank you for joining us on our weekly COVID update. We have a lot of familiar faces, and we do have a new face on today. So without further ado, I'm going to ask our uh, health agent extraordinaire who came in during a tough time and did a great job for us over the summer, and we owe her a great debt of gratitude. Elaine Silva, to say a couple words and introduce our new health agent, Anthony Chu. So Elaine, please begin once you unmute.
My words of wisdom are there's better. Nope, I'm off of mute now. Thank you for giving me this opportunity. It's been a great time, and I am so very, very happy. I will let Anthony do all the real good reporting this morning. Anthony Chu has joined us as our director for Melrose and Wakefield. He's wonderful. I hate to leave him. I want to work for him. I think he's a great fit for the towns and for the communities. He will do great work. He's so public health that he makes me. I'm just so thrilled. I think I'm happier than he is. And without further ado, Anthony, I'll let you take the lead today. You're the boss today.
Great. Thank you, Elaine. Thank you so much for all your help. And I know that that help is not over. So we'll be in touch. Great. Anthony, shoot.
All right, sounds good. First of all, my name is Anthony Choi. As Elaine said, I am the new Melrose Wakefield Health Director. And I want to say a big thank you to Steve, Elaine, and everybody else here who has supported during this transition. It's been great, and I'm very excited to get started. This kind of an interesting first week, just kind of working into the role, but hopefully, you all bear with me while I kind of get used to it. So we're going to go through a little bit of just some of the data behind Wakefield's COVID counts right now. So in Wakefield, we've seen a slight decrease just in terms of average daily cases. Currently, in the last week, we've averaged about 4 new COVID cases per day. We've had 2, as of the previous week, and then this week, we've had 2 unfortunate deaths due to COVID. And so one of the things that we're working closely with our nurses to find out about, oh, thank you for sharing the screen there. So we're really figuring out in terms of reporting through our system on Maven, and just trying to get caught up with all the cases and making sure that things don't kind of fall through the cracks here. So currently we're looking at, we have 86 confirmed active cases right now. And as we go down a little bit, we can see that just by age breakdown, we're working towards vaccinating a large part of our population here. And so the sooner we can raise that number, the better. As we move into this fall winter stage here, we're hoping to avoid the patterns that we saw last year for COVID. And so we've got a few clinics coming up for flu, as well as other COVID clinics as well. So please stay tuned, and we will release those as soon as we confirm them. And we've been working closely with our school staff to make sure that our students are protected. We have pool testing. We also have routine testing as well. So we want to make sure that all of our students and teachers and parents are protected as well. And in the positivity rate section, so we're looking at just testing overall, both in Wakefield and looking at the surrounding areas. We have about a 3% positivity rate here in Wakefield, and we're hoping to kind of maintain, we want to maintain the number of tests that we're doing each week, so that we can kind of get a better gauge as to see what the community transmission rate is right now. So at the moment, I believe all of Massachusetts counties are in the substantial transmission for community transmission. So we want to make sure that we are still working towards, putting in place those measures. Masks, even if you're vaccinated, please keep on your masks. That will help us keep these numbers down, and reserve those healthcare facilities for those that need emergency treatment outside of COVID. So we're not taking them all on for COVID cases. But yep, that's the update this week. Thank you.
Great. Thank you so much, Anthony, and welcome aboard. Anthony will be at the town council meeting on Monday, the 27th. And Anthony comes with a great knowledge, including a master's in public health and epidemiology from Yale. And I teased him that he went to Yale because he couldn't get into Georgetown or Tufts. So you'll hear a little bit about that from some of the other alumni on the boards when they talk about their, or Brown, when they talk about their schools that they went to. But Anthony, welcome aboard. That's great. I'm going to shoot over to Doug Lyons to talk a little about the schools. Schools opened up, and great job, Doug, opening the schools. I've heard nothing but great things, and congratulations to getting that underway.
Thank you, Steve. Good morning, everybody. And so it's good to be here. We are kind of falling into a little bit of a schedule where things are settling down a little bit, where we finished our first complete week, which is always a milestone. And so we complete that week today. So just a quick update and to kind of build on some of the information that Anthony has already provided. Our data in schools, when we're looking at positive cases, we have 7 student cases and 3 staff cases. We also have a number of students in quarantine. We have 82 students and 1 staff member in quarantine. The breakdown for quarantine numbers that amount to that 82 are, we have 8 students at Dolbear, 2 students at Doyle, 54 students at Galvin, 2 students at Greenwood, 5 students at Walton, 6 at the high school, and 5 at Woodville. And so we have had a little bit of a bubble at the middle school. The good news is that a number of those students, about a third of the 54, will be returning to school next week. And so, or third, pretty close to, and then later in the week, we'll have more than half of those kids back. So the numbers, as they grow a little bit, they're going to shrink a little bit as students are returning. And so that's a quick snapshot of our numbers. Our vaccination rates, as Andrew pointed out, I think are strong, but there's still some ways to go. We are looking like, if we're looking at individuals with at least 1 dose, in the 12 to 15-year-old range, we're at 75% of the students in that age group that are able to get vaccinations. So we want to continue to promote and support that. In the 16 to 19-year-old age group, again, we want to qualify that with an understanding that, not all of the 18 and 19-year-olds are students in our school system, but that number is really strong at about 88%. And we're using these numbers as references to look at the data and how we can support members of our community to continue to be vaccinated. That's an important piece. We are also looking ahead to October 1st, when the Department of Elementary and Secondary Ed and Mass DPH will be creating a quantitative reference to the benchmark or the target that was used in the mask mandate, which was 80% of our communities being vaccinated. So when they say communities and they're referring to schools, they're referring to all personnel that are in our buildings, right? So we'll be working on collecting information on that. One note about testing, and so we in our schools will be training, our nurses will be training next week, as I'm sure Anthony knows. So next Wednesday, we will be training with a CIC group on how to use the test kits, the antigen test kits, and also on how to use the new software. So we likely will be training on the 22nd. We're going to shoot to get testing up and running. So when I say testing, in the Wakefield Public Schools, we are offering 2 testing programs. That is students that are symptomatic in school and students that are close contacts, that become close contacts in school, not outside of school. And so we're shooting to have that testing set up and underway the week of the 27th, right? And just to kind of give a little bit of more context to our quarantine numbers, the 82 is a big number, but I will tell you that 30 of those people in quarantine are being kept home because they're symptomatic, right? Or they're demonstrating symptoms that parents are concerned about. I want to say a big thank you to our parents in the community that are paying attention to that and still kind of erring to the side of caution and keeping their kids home until they can understand what those symptoms are, and maybe get their children tested if needed. So thank you to all of those families. And we're on to next week. It's another opportunity to do good work. So that's a quick summary from me. Thank you to everybody for your support.
Great. Thank you so much, Doug. Tom Walsh.
Good morning.
Morning, Tom.
I only have, Anthony hit pretty good on the numbers. My only recommendation to the people is on the traveling. I see that there's a lot of people that are still up there traveling by plane, and they should be doing the testing. We've done it for our own town employees and put out procedures that they should be taking place by the CDC. And I recommend to citizens of our community that if you're traveling, whether it's domestic or abroad, you stick to those testing. You test 1 to 3 days before you go, and you test when you come back, and then maybe quarantine yourself a little bit, because that's where we find some of these cases are stemming from, is from travel. We've had it in our own system through our own town employees. So my recommendation is just be careful when you're traveling. I know some people have to travel for business, whatever, but just be cautious.
Thank you, Tom. I think that's a great point. I think a lot of our cases in town are from traveling, and I see Elaine shaking her head, and that's been a big part of this. I'm going to switch over to our chair of the town council. Julie Smith-Galvin just texted me, and she has to do her day job this morning. But we do have our vice chair, Maureen Butt, here. Maureen, a couple of words.
Yeah, just no, this sounds great. I just want to thank Elaine so much for filling in. Really, you talk about jumping in, what easy retirement. So thank you so much for jumping in.
Welcome.
And welcome, Anthony. We're so excited to meet you, and welcome. And I will not make a Tufts Jumbo or Georgetown or Brown joke, because Yale is a great institution. But we are so happy to have you as part of the team, and look forward to meeting you at our next town council work. And Elaine, you're not going anywhere, right? Is my understanding.
I'm still kind of staying with Anthony and Melissa. There's a lot more to learn, and a lot more to go over. And I'm also still going to be doing contact tracing for Melrose. And I'm working on more or less the cases that have come up. As Melissa and Catherine say, I don't understand this. And I found something last night, and Melissa goes, oh, you're just so full of information. But it comes after being 20-something years in this. And it's my second pandemic. I say H1N1 was one, and this is my second, but this will be my second time to go into a semi-retirement, I think. I'm not going far.
You all wanted to stick around, so thank you.
Yeah.
Yeah, we're not letting you go anywhere, was my nice way of saying that. So I'm really excited that we will get your expertise and knowledge. And thank you, Doug, for those updates. I also am trying to do my day job, but thank you for the first full week of school and keeping our children and staff, your children and staff, all safe. I've only heard good things about how Wakefield is going from all my friends in the school system. So thank you, and thank you, school committee member Steve, who also joins us. Just one thing, and I don't know if this was discussed previously, but my day job is also at a health clinic, and we just got the announcement of how important flu shots will be. And so this is an ask of Anthony and Elaine, and also Steve is just making the flu shots so accessible. So farmers market, senior center, town council meetings, whatever we need once we get them, that this year the flu shot, which I think in years past weren't as, there were lots of people who didn't get them, but let's just, I'd love to just collaborate about how we just make it as easier as possible.
There'll be some announcements coming out on that shortly.
Perfect. I figured there would be, but so just for people to know, our work is going to require that we get the flu shot this year, which they've never done before. And normally we gave it at work. And then if you got it in town, like the last couple of years have gotten at the farmers market, and they just accepted. And this year they're going to need proof. And so that's something, I don't think I ever got proof of getting a flu shot. So something to think about too, of like, how do I show my work? I see Laurel coming in. I said something that excited her, but yes, as Laurel has given me my shot the last couple of years, I will need proof to show my office that I indeed got the flu shot. So just something to think about. And yeah, but thank you, everyone. Thank you, Steve.
Thank you. Great segue into Laurel, who you did pique her interest. So Laurel, you're on.
Oh, my arm was just tired. Yeah, so ditto again. I'm so pleased that Anthony has joined us. I can't wait to have Elaine as a board member again. But we are carrying on as a strong team. As I have compared communities, I remain very thankful that we have such a cohesive team all the way from the top, Steve. It's been a real joy, and I often hear that it doesn't go as well for other communities. So kudos to us. We're fortunate. Flu season and flu vaccine is upon us. We'll be posting a schedule. We have always been able to give people proof of vaccination, and also we do include all of the vaccinations that the Board of Health and the Health Department do enter into the Massachusetts Immunization Information System. It's a clunky system. One of the things that we always recommend for any vaccines that you may have gotten in the community is to immediately go into your patient portal and enter that. So I'm a patient at Mass General, for instance. I'll go into my patient portal and just write them a note and say, I got this vaccine on this day, and then it becomes part of my vaccine record. So there are lots of ways for us to maintain vaccine records. I always recommend that people keep their own copy. But carry on down here in the Vineyard is an indoor masking requirement in every municipality on the island. And up at Aquina, in the public areas, outdoors, you need to be masked. So that's kind of what's happening in different sections of Massachusetts. And you all have to be careful when we travel on the ferry, but I'll stay outside in the rain, keep my wrist down.
Thank you, Laurel. Thank you. And you said the right word. It's team. It's a real team. And I'm incredibly thankful for all the hard work that's been done here. And we're going to ask you to work a little harder and continue, but that's what we do. We do have Steve Ingalls, who's become a regular on our calls from the school committee. Steve, anything to add?
So thank you, Steve. It's just because I like seeing this group so much. It's fun. It's like a superhero team. I would also say thank you to Elaine and welcome to Anthony, just for joining. It's a lot of hard work, and seeing everyone put in that work and better the community is always a great thing. Anecdotally, I would just say for vaccines, we're seeing out of the high school low COVID numbers, and hopefully that's owing to their higher vaccination rates. So just even locally, we're seeing that the vaccines do make a difference. So we just urge people to, if they haven't already, go out and get them. They're easy enough. And that's it. So thank you, everyone, for all the work you're doing. That's all.
Thank you, Steve. Thank you very much. Couple of numbers to go over, a great segue. So Doug, you mentioned, I believe, 7 students. Unfortunately, 7 students.
Yes.
Okay. And so when you think about that, I mean, it's any student, it's awful that any one student has it. But that's 0.2% of the student population, roughly. So that's
right.
really good job there doing that. Wonderful. And our positivity rate is down. Last week it was over 4%. Our last show it's right around 3%, 3.4%. So that's good. We're still running close to 3,000 tests a week for the community. So please continue to get testing. It's very easy to get a test. You mentioned the travel policy. That is something that we're hoping that will also help keep everybody safe. And our vaccination rates are pretty good. It's still the 20 to 29-year-old, that age group that for some reason is the low person on the totem pole. And that's inched over 70%. So we're getting there that have had at least one shot. And speaking of vaccinations, we have a event, kind of a pop-up event, which will be on the lower common on the 25th a Saturday, and we will have vaccines available there from 12 to 6. Cataldo Ambulance will be running that. So it is a beer garden. So hopefully that'll attract those in all ages, but specifically in the 20 to 29-year-old. So I'm saying get a shot and a beer, or a beer and a shot, whichever order you like. So that would be wonderful for our community to get some of these people going where the people are, hopefully, to get them vaccinated. Last week, I threw a challenge to the men in the community, because as a community of Wakefield, women, 77.6% have at least one shot, and for males, it's 70.2. So last week, it was males were 10% behind. And when I mentioned that, and so the women increased their lead to 10.4. So again, showing that women are much smarter than men. I know I see all the thumbs up there, so I agree. So guys, come on, you're not indestructible. So please go out, get the vaccination. That's the best way to get out of this pandemic and to move forward. So that being said, continue to stay Wakefield. Can you stay safe, Wakefield? I hope that the trends continue to go down. You know, wear the mask when you're in an area where there's, you know, a lot of people, and you feel that you can't make that social distance inside or out. And you know, get vaccinated and be safe and follow the protocols. So if nobody has anything else, no, all good. Have a great, safe weekend, Wakefield. Hopefully we'll have some nice sunshine and fresh air and get out and enjoy it. Okay, take care, guys. Thank you very much.
Thank you.
Thank you.
Thank you.